Hi, my name is Eric, and today we're going to talk about what happens when you get into the mental health system. And when I say system, I mean what should you expect when you have a therapy session, a psychiatrist session, inpatient. What do you expect if you seek out a therapist to try to help work through the situation that's going on in your life? Thoughts, actions. What I can tell you is that conversation between you and your therapist is 100% private. The only time that therapist can take it to the next level is if they feel that you're a threat to yourself or others. That's where it steps outside the bounds. But just talking about what's bothering you and getting feedback, because these folks see it every day, and good chances are they've seen numerous situations just like yours and how to resolve it. So you get a therapy session set up and you go to the session. What are you going to expect? Well, you can expect that they're going to ask you, what's the biggest problem going on in your life right now? And why are you here? What can I do to help you? And my suggestion to you is be 100% honest. Even though you don't know that therapist yet, that therapist can't work with you on issues if you're not being honest. And that means being honest with yourself and being honest with them. 100% confidential. The biggest reason most people won't seek out a therapist or a mental health professional is because of the stigma. It's pretty sad, huh? I mean, it's not as bad as it was 20, 30 years ago, but you're still judged if other people know. What I can tell you is that a lot of people do receive therapy at one point in time in their life. Policemen, firemen, doctors, even therapists. At some point in time, they're going to see someone to talk to. So let's say you have an appointment with a therapist and the therapist says, you know what, I think we need to take you one step higher, and that's to put you on meds. That's where your psychiatrist comes in play. What should you expect from that? Now you're sitting in front of the psychiatrist. What should you be doing? 100% honesty. Hopefully that psychiatrist is going to be asking you what is the biggest thing going on in your life that is causing a disruption. And with the help of your therapist, you might be able to fine tune it. You think it might be here, but it's actually here. And that therapist will talk with your psychiatrist so that they work as a team to try to get you well. If you're not 100% honest with those two, how do you expect them to help you? You're just taking up space. You're wasting your time, wasting their time. Let's say you end up inpatient. Inpatient is when you're in an acute mental health facility behind locked doors. There's two types. One is voluntary, one is involuntary. Almost every unit that I know of will try to keep you at voluntary. Voluntary means there's no record externally outside their system that you were ever committed. What should you expect? They try to give you a space where it's safe. They have their own psychiatrists, they have their own therapists, they have their own treatment coordinators. And they try to figure out what's going on with you and how can they help. And if you're part of the 99% of the people that go inpatient, your first thoughts are going to be to say and do anything to get out. And that's the worst thing you can do. The absolute worst. Because it's wasting your time. It's wasting their time. You're in a safe place in a hospital, or they can try medications, and if there's a side effect to that medication, intensive care, the ER, everybody's right there close. They're all in the same building. If you're doing medication changes at home, that's why I say you need to be honest. Hope that the conversation that we've had today helps you get a better understanding of what to expect if you're seen by a therapist, psychiatrist, or if you go inpatient. Now, what I'd like to tell you, or what I'd like to ask of you right now, is that if you find that the content that I'm pushing out here is worthwhile, if you could please like and subscribe. That would help our channel out a lot. And on that note, you guys have a great day. Thanks so much for watching.